Hi guys, it's that time of the month and you're yet to see your period. Before you start to panic or celebrate, let's talk about what could be behind the cause of delayed period, as it might not always be what you were thinking. So in today's video, we're going to be diving into the topic causes of delayed period. Don't touch that dial, let's get started. So the first cause of delayed period we'll be talking about is intense stress. High levels of stress, physical or emotional stress, can disrupt your menstrual cycle, leading to a delay in your period. Stressful life occurrences or events such as taking an exam, school stress, work stress, losing a loved one, planning a wedding, can cause the release of certain stress hormones such as cortisol. Now, this stress hormone can in turn cause a disruption in important hormones such as estrogen, which plays a vital role in your menstrual cycle, leading to delayed period. Still on the topic of intense stress, a recent illness that is associated with elevated body temperature. What I mean is, if you had a recent illness that was associated with fever, then it is likely to cause a delay in your next menstrual cycle. The next is hormonal imbalance. Medical conditions such as polycystic ovarian syndrome, thyroid dysfunction, which could be hyperthyroidism or hypothyroidism, hyperprolactinemia, premature ovarian failure, that is early menopause. All of these can disrupt your menstrual cycle, resulting to a delay in your period. So before we talk about other causes of hormonal imbalance, let's talk about polycystic ovarian syndrome. Now, this medical condition is the most common gynecological disorder resulting to hormonal imbalance in women. It is usually associated with symptoms such as few periods, maybe 5 to 6 times in a year, no period at all, or delayed period. However, delayed period, no period, scanty period, or few period is not the only way to diagnose polycystic ovarian syndrome. There are other criteria that are put in place to make diagnosis of this condition, and these criteria include acne, that's pimples, male pattern of hair distribution, what is called hirsutism, presence of hair on the chin, presence of hair on the chest, and also presence of cystic ovaries. However, these cystic ovaries can only be detected with the use of an ultrasound scan. Another thing that can result to hormonal imbalance is contraceptives. Now, the use of hormonal birth control such as pills, injection, IUDs, implants can alter menstrual cycle, resulting in delayed period. And the thing is, delayed periods can occur while you are on this contraceptive, or even after stopping these contraceptives up until 6 months before you can start or resume your period again. The number next that can result to delayed period is lifestyle factor. Excessive exercise, intense physical activities can, suppress your ovulation, leading to a delay in your period. Extreme changes in diet or having an eating disorder, all of these can impact on your menstrual cycle by interfering with some of the reproductive hormones, leading to a delay. Sudden weight loss, sudden weight gain, obesity, or low weight, all of these plays a factor in causing a delay in your period. The number 4 cause of delayed period is medications. Some of the medications that we might be on can actually cause a delay in our periods, such as antidepressants. An example is citalopram, amitriptyline, antipsychotics, chemotherapeutic drugs. All of these can disrupt our menstrual cycle, resulting in delayed period. Number next, which is number 5, that can result in delayed period is underlying medical condition. If you are dealing with endometriosis, pelvic inflammatory disease, thyroid disorder, diabetes mellitus, all of these can actually disrupt a menstrual cycle, leading to a delayed period. The number next, which is the number 6, is miscalculation. I feel like majority of females fall victim of this, and this is because they do not keep a track of when they saw their period, the date they started their period. If you're not the type that usually keep track record of when you started your period, then it is going to be easy to misremember the actual date of your period, and this can make you assume you're having a delayed period when in actual sense your period is not just being delayed. So to solve this problem of miscalculation, I have some solutions for you. Use a tracking app on your phone, or you use the calendar method. With this, you can be able to track when your next period will be and also identify the pattern of your menstrual cycle. The next is breastfeeding. Now, if you are lactating, it can actually cause a delay in your period, and this is because during lactation, prolactin level is elevated, and prolactin can suppress ovulation, leading to a delayed period. The last we'll be talking about, which is the number 8 if I remember correctly, is pregnancy. Pregnancy is actually the most common cause of delayed period in women of reproductive age. So if you missed your period, you're sexually active, and you have other symptoms such as vomiting, body weakness, nausea, you should go and do a pregnancy test. You might just be pregnant. You might just be expecting a baby. When to see a doctor? If you have a delay in your period that has lasted for more than a few weeks, that is recurrent or associated with other symptoms such as abdominal pain, significant changes in your weight, abnormal vaginal discharge, presence of hair on your chest or on your chin, you need to consult an healthcare provider. In conclusion, a delayed period can be as a cause of varieties of factors, which include hormonal imbalance, medications, underlying medical condition, lifestyle modification, to natural processes such as pregnancy and breastfeeding. While occasional delay may usually not be a cause of an alarm, persistent irregularity in your period could be a pointer that there is an underlying medical condition that will require a medical attention. Hence, you need to see your doctor today. Thank you so much for watching today's video. If you've learned something new today, don't forget to give this video a thumbs up, comment, share, and hit on that post notification button so that whenever I post a new video, you'll be the first to get notified. And please, if you've not subscribed to my YouTube channel, please kindly do that. Thank you so much. Before we continue, if you've not subscribed to my YouTube channel, please click on the subscribe button now, and also hit on the post notification button so that whenever I post a new video, you will be the first to get notified. Also encourage me by liking, commenting, and sharing my video. God bless you. Let's move on.